The idea behind the collective is to really work together, to pool resources, to start collaborating, and to find ways that we can better serve our audiences and the public here.
I think the KC Media Collective is an opportunity for us to redefine how newsrooms interact in Kansas City. I think this is a potential for us to replace competition with collaboration.
We're hoping to create a model that makes this kind of thing and that makes local journalism sustainable years and decades into the future.
No idea is a bad idea, and we're sort of throwing out the traditional rules and trying to find the way forward.
Nonprofit media organizations can do more good work together than they can apart.
We know that an informed citizenry is the bedrock to a strong community, and we believe that through our collective efforts, we're able to better serve and inform the community so we can be stronger and better together.
Good evening, and welcome to Community Conversations presented by the Kansas City Media Collective. The KC Media Collective is a group of nonprofit and community centers collaborating. Sorry about that. The KC Media Collective is a group of nonprofit and community-centered partners collaborating to make local news easily available. We are committed to efforts that emphasize mutual understanding and empathy within the greater KC community. We are working towards a day when people have access to trusted news and communities benefit through greater civic engagement. The KC Media Collective includes American Public Square, Flatland, the Kansas City Beacon, KCUR 89.3, Startland News, Missouri Business Alert, and KCPBS. My name is Denisha Snell, Director of Programs at American Public Square. The fall of Roe v. Wade had immediate sweeping impacts on reproductive rights across the nation. Kansas has become a critical point of healthcare access for those living in neighboring states. It will also be the first state to test voters' views on the issue. As Kansans prepare for an August 2nd special election to vote on whether the state constitution guarantees a right to abortion, what are your questions? The goal of today's event is to engage experts and community members in a civil, balanced discussion, exploring the economic, legal, and human implications of the August 2nd constitutional amendment vote. As part of tonight's programming, we welcome questions from the audience. Please use the Q&A section of the webinar to ask questions of the panel. Lucy Brock, intern with American Public Square, will serve as today's roving reporter. With that, I will turn it over to our moderator, Flatland Senior Reporter, Mary Sanchez. Mary?
Guess I would have to unmute. Thank you, Denisha, very much for the nice introduction. and to all of our panelists for agreeing to participate tonight, and to everyone who is watching or may watch this on a recorded venue later on. As she said, this is just it's a really important time. So we were really grateful that we have so many differing voices. And what we want to have is just a conversation. I mean, this is a topic that draws so much interest. But oftentimes I think, like with a lot of issues, we do tend to just go into our own little silos and speak to people who believe as we do. And what we really need to hear is maybe from others, and why do they believe what they believe? How is their work done? For those that are engaged in a way within their profession. So with that said, let's go ahead and introduce the panel a little bit more, and then we'll have each of them say something to just kind of describe how they come to this issue. That should help kind of set the scene a little bit, so our questions can come in perhaps a little bit better, than who you might want to ask your question to. So first off, I would like to introduce Sandra Thornhill. Sandy is the founder of the Sacred Organized Spaces and serves as a perinatal doula trained in childbirth education, reproductive and sexual health counseling, and peer lactation counseling. In addition, she serves as a professional organizer and community organizer, mobilizing people across the state to claim their peace. Sandra?
Hello, everyone. Hi. First, I'd like to say that I'm honored to be present with you by the grace of the Creator, the tenacity of my ancestors, the fight of my siblings, and the fire that burns so bright for the next generation that I get to hold space and make space for. I'm a being of love, light, and energy. I serve in many roles here in this realm, but today I am honored to represent and join you as a representative of the BIPOC birth working community and as a Black birth warrior, a mother of a very active 3-year-old son, a sister to many, and a sibling to many further out. So I'll be joining you from the perspective of a BIPOC birth warrior, birth advocate, and a birthing person myself.
Great, thank you so much, Sandy. Next, I would like to introduce Professor Neil Allen. And Professor Allen is Chair and Associate Professor of Political Science at Wichita State University. Go Shockers. He teaches and studies about American politics, Kansas politics, and the law and the courts. And he's a regular guest on PBS Kansas Week, and has been interviewed by NPR 1A, CBS Evening News, and several state and local news outlets. Professor, thank you so much for joining us. And obviously we will have many questions for you. If you want to go ahead and give just a little bit more about yourself and what you bring to this conversation.
Sure, thank you. I teach and research about American politics here at Wichita State University, which is for at least a short amount of time for the next couple of weeks, part of the most important place to decide how we are going to balance the rights of various competing people and views about abortion and women's reproductive freedom. And also my perspective, especially for tonight, is particularly on the process by which we came to have this ability to make this decision on August 2nd, and actually now with early voting and mail voting, and also how that process advantages or disadvantages certain perspectives in this particular discussion. And I just thank you for the opportunity to talk with my fellow citizens.
Wonderful, thank you. Yeah, definitely, that will be a great perspective to show, and frankly, quite educational, which we should expect from the professor. Okay, next, I'd like to introduce Elizabeth Kirk. Elizabeth is the director of the Center for Law and the Human Person, research associate, and lecturer for the Columbus School of Law at Catholic University of America. Elizabeth also joined the Columbus School of Law after serving as the director and Kowalski Chair of Catholic Thought. I'm sorry, I'm trying to read this on small print at the Institute for Faith and Culture, at St. Lawrence Catholic Campus Center at the University of Kansas. So obviously you're very familiar with the Lawrence area. And I think you're actually, you were from Johnson County, or I might have that wrong. Why don't you go ahead and say a little bit more about yourself?
Sure. Thank you, Mary, and thank you to my fellow panelists and to the collective for inviting me. Yes, I lived in Overland Park for many years when I taught at the St. Lawrence Center. I also grew up in the Kansas City area. So while I do live in the DC metro area, I am a Midwesterner at heart. I'm actually home here in Kansas City right now, visiting family. I come at this issue predominantly as a scholar. My area of interest is law and the family, especially adoption law and policy. And I provided legislative testimony in the Kansas legislature on the Hodes decision. That's the Kansas Supreme Court decision that gave rise to the amendment process and the impact of the test the court adopted and the need for a constitutional amendment in response. So I'm grateful to have been invited to participate and to speak further about the issue.
Great, thank you. I'm glad to hear the adoption, because that's one of these issues that we need to probably talk about more. It's kind of coming in a little bit more often into some of these conversations, but I think it's one that needs to be had. Let's see, so next on our panel, Dr. Jonathan Scrafford. Dr. Scrafford is a board certified obstetrician gynecologist in Wichita, Kansas. He was born and raised in Wichita and is proud to serve the women in his hometown community. Doctor.
Hi, yeah, thanks so much for having me on. My name is Jonathan Scrafford, and it's a joy to be here. I am very glad to have been invited. I was born and raised in Wichita, Kansas. I spent a few years in California and a few years in Minnesota before coming back home in 2017. And it's been a real joy to practice as an OBGYN in Wichita. OBGYN is a really fun field a lot of times, a really joyful field a lot of times. But as an OBGYN who's been practicing for a few years, I also am sober to the fact that pregnancies aren't always happy and that pregnancies can sometimes end tragically, as well as pose significant threats to the mom. And again, having practiced for a few years, I'm sober to those facts. And I hope to just be a resource to, answer questions related to medical stuff as they come up, and otherwise to engage in conversation where I can. Thanks so much for having me.
Great, thank you so much. I think it's very important that we have a doctor's perspective here. Okay, next on our list, and actually it's a finally, we would like to welcome Michael Papa. Michael Papa began with the Mainstream Coalition as executive director in January 2020 after serving his first term on the Roland Park, Kansas City Council and working as a director of member engagement for Northeast Johnson County Chamber of Commerce. He's honored to be part of the Mainstream Coalition / Voter Network team and to help further efforts to inform and empower Kansas voters to take meaningful action in the political process.
Hi, Mary. Thank you very much. Thanks to everyone watching, the other panelists, and of course the KC Media Collaborative and Denisha for hosting the event this evening. As you mentioned, I'm executive director over at Mainstream Coalition, and we were founded about 30 years ago by a bipartisan interfaith group of community leaders, then known as the Modern Alliance of Informed Neighbors. And they came together, they coalesced to fight extremism and guard primarily against the encroachment of religion and government. Since then, our scope has grown, and we are known for really working within that space between the party aisles, because we believe that's where real change happens, and our differences make us stronger. So we try to bring different voices and ideologies to the table to get the best policy that we can for all Kansans.
Great, thank you so much. And finally, I want to introduce Lucy Brock. Lucy is our roving reporter this evening. She is, I think she's over at the Urban Building, right? Anyway, that she'll be just gathering some of these questions to help us. There's Lucy there. Did you want to say something?
Sure. Hi, everyone. My name is Lucy Brock, and I will be the roving reporter today, and I'm really excited to help facilitate discussion between the audience and the panelists.
Great, wonderful. And you can kind of like wave at me or something, and kind of just for our panelists, since this is, I'm staring at two laptops on my dining room table, frankly. And, if you need to kind of like raise a hand or something, almost when we're in person, it's so much easier to kind of convey a conversation. But, we have some questions and some that you've submitted that you wanted us to ask. But we'll start off in a certain way. And then if someone wants to kind of add into that strain. One of the things where I wanted to start was Wichita. I mean, that is so prominent here, Kansas, obviously. And I'm wondering if Professor Neal, if this maybe is where you could, can you talk about why Kansas? I mean, how did this happen? Because it did not just happen from, where people started hearing value them both. I mean, frankly, as a reporter more than 30 years, Kansas has always been prominent on reproductive rights. So can you give a little bit of background, and perhaps some of the other panelists would like to add some as well?
Sure. And so here in Wichita, we're fairly unique in the United States in that we are a place that leans Republican, and in a state that leans Republican and conservative, but has fairly good access to abortion care for women. So in the United States at this point, most clinics, particularly ones that do what we call surgical abortion, tend to be in very large metropolitan areas or possibly college towns. And Wichita is neither one of those things. It's a mid-sized city on the plains in a fairly conservative area. But also, we have two organizations in Wichita that are very active in providing abortion care. One, Planned Parenthood, that does medical abortions, and one called the Trust Women Clinic that does medical abortions and surgical abortions. The Trust Women Clinic has existed in the same space that was the old Tiller clinic that was a provider of abortion services who was assassinated in 2009. And he had been the target of protests by those who saw abortion as murder and as ending an innocent human life ever since 1991. And so Wichita has been a site of that kind of political action for a long time. And so it's been a part of our politics for decades now. And also because Wichita is the closest place with working open abortion clinics to Oklahoma and much of Texas, that now after the U.S. Supreme Court decision striking down Roe v. Wade, and for Texas, really, there was a law that in effect ended abortion access prior to that. Since the access has been denied in those places, now Kansas has become a regional center for abortion, and that is now an effect of the Kansas Supreme Court decision that Professor Kirk made reference to. And so with Value Them Both, Wichita and Kansas in general are really the most important place for American democracy and about the issue of abortion right now. And also one thing just to note for those who either are not from here or new to Kansas, Kansas is a conservative and Republican place in its voting patterns, but it's not the most conservative or Republican place in the country. There are many states that are more conservative, especially socially, than we are. And frankly, if Value Them Both passes, it is not entirely clear what the Kansas legislature will do. And there's a variety of policy outcomes, all of which will be much more restrictive on abortion than the current law under the Kansas Supreme Court decision. But many avenues of policy are possible. And frankly, one of the difficulties for citizens is they're being asked to vote on August 2nd without a clear idea about what policy changes will happen. And the text of the Value Them Both Amendment does not make clear what those choices, what that future is going to look like.
Okay, why don't, Elizabeth, would that be a good place for you to start? Because you had wanted to explain how Value Them Both actually kind of came into being out of the 2019 Kansas Supreme Court. So I'd like to kind of just get someone to explain more, what are people voting on? And then I'll probably ask Michael to come in here too. Do you want to go ahead and take that, Elizabeth?
Sure. Yeah, I think just following up on something that was said at the end there about Kansans are voting on a sort of uncertain future. It's true that the value them both amendment is completely neutral on abortion policy. And so it doesn't require or, forecast any necessary legislation or abortion policy. That then is just up to the people of Kansas. But what is sure is what we have now, which is the test, the very rigorous test adopted by the Kansas Supreme Court in the Hodes decision. And that's what created the need for the amendment. So just to explain that a bit further, with apologies for any overly technical legal terms, but when the Hodes decision was decided in 2019, everybody sort of knows generally that the court found a state right to abortion in the state constitution. What isn't as well known is the two things that it did that make Kansas quite extreme in its abortion jurisprudence. The first thing the Kansas Supreme Court did was adopt a legal standard known as strict scrutiny. And this is a test that will now apply anytime an abortion law is challenged in Kansas court. And under this test, according to the Supreme Court's own words, any law touching on abortion is presumed unconstitutional. And in the court, so that the scale is already tipped to unconstitutionality, and then the court subjects it to this very rigorous, intense analysis under which the state almost always loses. The state defending its law almost always loses. And that standard, strict scrutiny, is so strict that it was rejected by the US Supreme Court 30 years ago in Casey. In the court in Casey, Justice Kennedy, Justice O'Connor, they wrote saying that test is too strict for a complex issue like abortion, one where there's these countervailing interests. The state has an interest in protecting women's health, especially in the first trimester. It has an interest in the developing life of the child as it grows throughout pregnancy. So strict scrutiny doesn't allow those countervailing interests to be weighed. And therefore, under that test, all existing laws in Kansas that we have right now, those modest laws that Kansans have adopted over the last 3-4 decades, will eventually be challenged and will be struck down. And just to explain that a bit more, because I don't want that to just sound like my opinion that they'll be struck down, I think there's 4 reasons, and I'll say them quickly, why I think Kansas laws are going to be struck down. One is that was the immediate opinion of pro-choice advocates. So the Guttmacher Institute spokesperson said, this decision means that nearly all Kansas abortion restrictions will be challenged and struck down. A second reason is we can look at other states that have found an independent state right to abortion and have adopted this very strict test, the strict scrutiny test. And when a state does that, it's the beginning of a long line of cases where they strike down abortion regulations like parental consent or parental notification or waiting periods, et cetera. This has happened in a number of other states. The third reason is that Kansas Supreme Court Justice Biles, who concurred with the result, he agreed there should be a state right to abortion. He wrote separately to criticize the adoption of this very strict test. He thought a less strict test, the undue burden test that balances these competing interests a bit better, is the one the Kansas Supreme Court should have adopted. And then my final point is just that this is already happening in Kansas. So since Hodes was decided, at least 2 laws have already been struck down by courts using the strict scrutiny test. So the ban on D&E, dilation and evacuation abortions, has been struck down, as well as an abortion licensing, sanitation standards, inspection requirements has been struck down. So the value of them both amendment, it's not something that pro-lifers sort of chose, right? This is something that's in response to that decision. And all it does is take that sort of balance that's been tipped to one side and make it neutral and allow the people to continue to embody in law the abortion policy preferences that they agree on.
Thank you. I appreciate that. And I think it kind of gets to the the part of this that we forget and, hasn't been dissected recently, frankly, and I think a lot of people's minds. So I wonder, Michael, when you hear that explanation and, within that, I'm kind of hearing all the just countering arguments that here, no, the amendment doesn't ban abortion and that it just reverses the right of the people, that sort of thing, which is that's within there. And that is some of the big confusion. Can you speak to mainstream's work of how you're trying to just eliminate the confusion so people frankly know what they're voting about?
Sure. I would actually have to agree with Elizabeth and Professor Allen that the amendment itself does not explicitly ban abortion. However, the amendment is not clear. The language is not clear, right? Which is why there's so much confusion around it. And it doesn't give any insight into future policy decisions if it's passed. However, it does open the door for a potential complete and total ban of abortion by the Kansas legislature. So it was mentioned that it puts the power of regulation in the hands of the people. However, it really only puts the power of regulation in the hands of 165 politicians, which is very concerning. We have heavily regulated abortion in Kansas already, as Ms. Kirk alluded to. I believe she said that the D&E procedure that is now allowable again in Kansas, but only up to a certain point. I believe it's only in second trimester, but someone may have to, Lucy, you might have to fact check me there. I could go through a list. There are strict guidelines still regarding safety and sanitation. There's mandatory informed consent. So these laws are in place and they are strict, but for the most part, a lot of them are common sense regulations. And I don't see those being struck down if the amendment fails, right? I don't see those being challenged. I do see that total abortion ban being introduced either as soon as the middle of August or in the next legislative session. There's been numerous abortion restriction regulation bills that have been introduced in the Kansas legislature. Most recently, this past year, it was House Bill 2476, I believe. And it was a pretty extreme bill that created criminal penalties for even IVF and fertility treatments. Now, that didn't go anywhere this past year, but it could go somewhere next year if this amendment passes. Plus, the National Right for Life organization has already handed down their boilerplate model state legislation, which is pretty extreme as well. And it does give caveats, but it does not give exceptions explicitly in the main recommended language for exceptions for life endangerment, for rape, or for incest. And that's really what we're concerned about here.
Thank you. And I would like to hear from Sandra, just, what are you hearing within your practice? And because some of this is fear, what are people afraid of? And perhaps maybe we can, debunk some of those if some of the fears really aren't practical. Just, how do you think this is going to affect the people that you work with?
Yes, thank you, Mary. And that's exactly the lens that I'm thinking about and coming from further out, bringing that lens further out from reproductive rights. The community I work with, we speak a lot about reproductive justice. That's what we're centered in. And reproductive justice is centered in the intersectionalities of our rights, of our sovereignty over our body, to be present and to present ourselves how we choose to, and to choose to have families or not have families, to have access. So as a reproductive justice advocate representing the community that I serve, we're always talking about access. That is our first and foremost, most important piece that we're leading with. And so access to decide when, how you want to create your family is very important. So abortion access is very important and is key, but it's not the totality, especially as you think about historically marginalized group, our MAGES. And so when I hear the confusion in the language, and also when I hear how this amendment is neutral, is very concerning for my community, because there is no neutral decision for a BIPOC community. All decisions impact us in some type of way, and this decision impacts us in a very negative way. From a reproductive justice lens, we are already 50 years behind to our goal of reproductive justice, years behind. And so to have reproductive rights, or have abortion as a right, be something that's just one step ahead. And now our nation as a collective has taken 50 steps back from reproductive rights by repealing Roe v. Wade. And if Kansas moves forward with this decision that seems like low-hanging fruit, and that is so-called neutral and seems like you can just blink an eye and it doesn't really matter, it's really going to set us back even further. My community is not confused about what this decision means. My community is very clear that this is a decision that is going to greatly continue to negatively impact us, continue to cause us to struggle just to have access to the essential healthcare needs that we have, and continue to be marginalized even further on the greater, on the nation's stand. And so this is very concerning for us. It's not confusing for us. It's very clear that legislators are looking to position themselves in positions of power to make decisions over our bodies. And we're done and we're tired of that. And we're fighting for sovereignty for our bodies. And so any decision or any language or any legislation that is going to restrict access from power to the people, from shared power from a collective people, is going to greatly impact the BIPOC birthing community and just BIPOC people in general.
Thank you. I appreciate that. And I think one of the things that, we often hear probably, and just definitely needs to be said, is, the high rates of maternal morbidity within African-American and Indigenous people. It's already a huge disparity. And so that's part of the fear, is that if you limit access to reproductive rights, that is going to just escalate. So that, that's something that I think definitely does need to be said. We've got some questions coming in, but I actually wanted to hear from the doctor. Just, is there something that we're missing that's often misunderstood just about, what is abortion, or, just how you see pregnancy coming into your clinic, your office? What is it that isn't being said from your perspective?
Yeah, I mean, so far, there's not too much to weigh in on. I really appreciate all the, experts in public policy kind of laying the groundwork. I know within my framework, I have heard what I would consider, misleading information about the conflation of the concept of abortion with medical care not associated with abortion, most notably with things like miscarriages and ectopic pregnancies. And I understand a lot of this conflation, mainly because, especially within the medical community, the terminology that we use to describe both like elective terminations of pregnancy and miscarriage often contain language like abortion. So there are some semantic reasons why I think the two can kind of get confused. And then there are medical reasons why there's some confusion, I think, between how policy applying to abortion could or could not be affecting medical care of things like ectopic pregnancy, where the pregnancy is developing outside the uterus, a condition that's not compatible with, continuing pregnancy safely for mom. As a physician, I've heard this from patients too. Even within the last couple of weeks, I've had a patient about to undergo a D&C who asked me, if it was true what she heard, that she wouldn't be able to have a D&C if the amendment passed for a miscarriage. Now, as a provider, that disturbs me, not only because, that wouldn't be a direct fallout of the amendment, even if we were actually talking about, abortion, but also because even if we're talking about the fallout in terms of subsequent legislation, sound public policy really is fully capable of differentiating elective termination of pregnancy from things like miscarriage management and ectopic pregnancy. So that is one of the biggest things that I've seen in my work so far, is just patients expressing confusion about whether policies applying to abortion would also apply to things like miscarriage management and ectopic pregnancy. And I would, as much as I can, I try to reassure the public that, we can have our disagreements about elective termination of pregnancy abortion, but that I am very confident that the medical community will continue to be able to care for people with miscarriage and ectopic pregnancy, no matter what the, public policy is regarding abortion. I feel confident that we as a medical community would be able to do that. And at least as a physician, I haven't really seen a threat from that, from the proposed either amendment or legislation that I've seen so far.
Okay, thank you. No, I appreciate that. And frankly, that would be a point to make for the media collective, because part of what we want to do is, as mainstream print continues to decline, and frankly, I was at the Kansas City Star for years. Most people know that, and I lived through that. And part of what we want to do is, how can media go forward and better serve? And I would actually have to say, I think media has been a part of some of that, kind of that conflation and not getting it right. So I appreciate that point there, because what we want to do is not rile and agitate, but inform. That should be the purpose of strong media going forward, particularly on issues like this that are just so impactful on people's lives, and on our communities. Lucy, I wanted to turn to you and see if you wanted to put a question to our panelists. And then Sandra.
Well, it looks like Sandra might have something that she wants to say first.
Sure, go ahead.
I wanted to speak to Dr. Scrafford's point. Some of the work that I do, one of the organizations that I work with as a co-founder is the Missouri BIPOC Reproductive Justice, Missouri Kansas BIPOC Reproductive Justice Coalition. And so we advocate on both the Missouri and Kansas side. And as a physician, you mentioned that you don't have as much concern about, like you have confidence that to assist an ectopic pregnancy or medically needed abortion, that you don't think that could possibly be threatened. But on the Missouri side, there actually was a House bill that was presented where that very thing is one of those legislative pieces that was presented as potentially being a threat, where for anyone who supports someone getting even an ectopic pregnancy can be penalized, can be punished by the law if this bill were to pass. And so when things such as the value in them both amendments, creates or opens the door for more repressive, fallback legislative actions to happen, then even doctors down the road may be facing something that our neighboring state, Missouri, which is where I live, is facing in our bill right now. And so I think that, we would want to say that we would hope that those type of things wouldn't be threatened, but we see that in Missouri, when there's a bill that's out and potentially threatening doctors or maybe even an Uber driver who takes somebody to get an ectopic, support if they're having an ectopic pregnancy, then that's something that we should also be mindful that this can be down the road. Again, I see this legislation as low-hanging fruit for a branch for Roe v. Wade that's really off the tree of the 14th Amendment. And so I see it as a threat to our basic human rights, and see it as a threat to our basic civil rights as well, that we have fought so long for, even as support persons, as a doula myself, to support someone who is having an ectopic pregnancy. In Missouri, if our bill passes, I can see, as the doula community is like, well, will we be able to support our clients, So I can see that also touching like medical community as well.
Sandra, I think that was pretty much exactly where the conversation seems to be heading in the question stream. I think if I could pose a question to this panel that I think all of you can weigh on in some respect, is what the implications of the language of this amendment are. What immediately happens after this amendment passes or doesn't pass? What are different communities fearing? What are different communities expecting? I think that would be a conversation that people would want to get a lot of clarity on. So Mary, I don't know if you see somebody who might be a good person to take point on this, but I'll just leave you with that prompt.
Sure. Thank you very much, Lucy. And I think the first hand that went up was Professor Allen or Professor Neal.
Thank you. And I happen to be named Neil Allen, but my parents gave me a first name that's a last name and a last name that's a first name. And so that is always confusing. I'm not going to talk about what people fear necessarily in opinion, but more about exactly how the amendment's language is actually less clear than I think our discussion can make it. Because frankly, I think Professor Kirk's description of what it does and how it specifically in response to the Hode's decision is a perspective that frankly, you don't have enough words to get into ballot language. Even if you spell the words on the ballot correctly, as we're not having here in Sedgwick County, because our election office has misspelled both circumstances and pregnancy on the ballot, but that's not going to cause any serious problems. But if you look at the actual language, there's three problems I see that are just vague that I don't, or misleading. And I don't know if these things are intentional or not, and they're dealing with important issues, but in ways that I don't think are clear, or at least fit the reality. One is there's specific discussion in the amendment, in the description of the amendment about state funding for abortion. And so a voter could read that as saying that a yes vote eliminates state funding for abortion. Well, there is no state funding for abortion in Kansas, and there will not be in the foreseeable future, because that is not what Kansas voters or their legislators want to do. And actually, and that's also banned on the federal level. And also, Kansas voters can throw out any legislator that votes for that and would likely do so. The second thing is involving life of mother, health of mother, and rape and incest exceptions. Those are discussed in the amendment and the description as well. Voting for the amendment does not create those exceptions. Those exceptions could be created now by the legislature, or they could not. If the amendment passes, the legislature would have the ability to create exceptions, but the amendment would not create any need or directive for them to do so. That would be up to the ordinary political process. And the last thing that I think is misleading is frankly the name of the amendment itself, value them both, because it makes you think of something that we all agree on, that all of us value women and all of us value human life and babies, and at least have an understanding that infants and all of us come from a fetus that was inside a woman's body prior to birth. But it's not clear what the both actually means. I have a pretty good understanding of how value them both would value fetuses as potential human lives, but I'm not sure exactly if it's clear what value them both means about the woman. And the way it makes sense to me is that value them both makes sense only if you value women by protecting them from abortion, and the choice of abortion, which many see as a choice which should not be allowed to humans, just like murder and use of certain drugs and theft and assault and things like that. And so I think that this is packaged in a way that I think it can mislead people about what the real policy consequences are. And frankly, it would be nice if it would say instead, the Kansas Constitution does not contain a right to an abortion, and the Kansas legislature shall have the power to make whatever abortion restrictions that they see fit. And that's what it's going to do. And I think, and it might very well pass, but that's clearer than the gobbledygook and word salad that we're being asked to vote on right now.
Thank you. I appreciate that. Elizabeth, did you want to answer to that, or Michael? Who wanted to go first?
Sorry, I would love to respond to each of those points, actually. I think that the amendment, if read carefully, is not misleading. And I would respectfully take issue with the characterization of Professor Allen of each of those points. I think the phrasing, the Constitution of the state of Kansas does not require government funding, means simply that the Constitution doesn't require it. If the voters of Kansas want to provide funding for abortion, they certainly can, but the Constitution doesn't require it. The reason for that, again, you have to remember this amendment is, the need for it is triggered by Hode's. The Hode's opinion cited numerous other state cases that had held there was an independent state right to abortion. They adopted strict scrutiny. And in later cases, they said that required constitutionally the state to fund abortion. If it's such a fundamental right, how can we deny the state to pay for it? That's what other states have concluded. So although you're right that right now, Kansas doesn't require funding of abortion, under HODIs, it will. I mean, that's what other states have done. A number of other states have done that. So it just simply says, does not require funding. The second point on the exceptions, rape and incest, et cetera, that whole second sentence is simply illustrating the sort of thing that the legislature may wish to do. The word may is in there, right? So, you know, the people through their elected representatives may pass laws regarding abortion, including, but not limited to, laws that account for circumstances of rape, incest, or the life of the mother. Those are the very typical exceptions that many, many laws include. And they were just referenced as the sort of thing that the legislature might want to pass. And then finally, this point about because Kansans value both women and children, I can think of at least one very important reason that I think pro-choice people would agree values women, which is health and safety regulations of clinics, one of which has already been struck down under the HODI standard. Under Roe, which I don't think everyone wants to get into a complicated legal history, but Roe had adopted strict scrutiny. And as I said earlier, that was then reversed by the Supreme Court in Casey. They thought strict scrutiny was so strict. One of the reasons that Casey thought Roe was too strict is because it didn't allow the state to pass regulations providing for health and safety protections for women who wanted abortions, right? So that was something Casey did. It loosened up the law a bit so that states could demonstrate their care for women by making sure clinics are safe, sanitary, clean, et cetera. And so that's one way in which even laws that allow abortion can value women.
And I would just like to add, and I agree with Professor Allen that the language is pretty confusing, and whether or not it's intentionally written that way, it is a bit misleading. It was mentioned a couple of times that the Constitution doesn't require the government funding of abortion. Well, it doesn't, and it is already that way, as Professor Kirk pointed out. And so my question would be to the writers of this amendment is, why isn't every single current regulation then listed out in this amendment, instead of just the regulations that are the most polarizing? Government funding of abortion, rape, incest, necessary to save the life of the mother. And in that sentence even, which is very misleading, it nowhere says that the legislature may regulate abortion health care, including exceptions for circumstances of pregnancy resulting from rape or incest, or when necessary to save the life of the mother. It just says that they could make laws about that, and they could regulate that. Since we already have that exception in place, my logical conclusion would be that they could regulate to remove those exceptions.
Thank you. Did you want to have a reply to that, Elizabeth? I didn't really want to start like a debate, but I think, it's good to flesh these things out, to show a little bit different views, but some of it gets into how strictly things are worded and reading. Frankly, from a marketing perspective, whoever came up with value them both was right spot on for what they wanted to do. And I think it is good to actually talk about what the language does and doesn't mean. Did someone else want to add on, or should we go ahead and move on?
I do want to say I wasn't trying to wade into debate territory there.
Oh, no, I did. Sorry, I didn't really mean that as a challenge that you were.
No, of course.
I also, on one thing that Professor Kirk, I think, was spot on about is that the HODES decision is a stronger protection of women's reproductive rights, or at least the among their many reproductive rights, the right to choose to have an abortion, that it is a stronger protection than existed in federal law at the time it was decided. And I think you can even argue that it might be a stronger protection than that of Roe v. Wade, which was either weakened or at least modified significantly by Casey, which is now not also not also federal law. And that what I think from a democracy small d perspective here is, what I'm afraid is basically we have a situation where the people of Kansas had a state Supreme Court that, because of frankly some of the just luck of who got appointed when they got appointed, came to a position that frankly I think is much more pro-choice than the median voter or the majority of Kansas citizens. And on the other hand, if either both passes, we have the possibility of something that frankly in 2019 I'm not sure that a lot of people thought was going to happen, of other states around us that have passed total bans on abortion without the kind of exceptions that would get a majority position in Kansas. And so while the Kansas legislature could conceivably pass a total ban, I don't think that reflects the views of most of its citizens either. And what concerns me is we're going to vote on this in a low turnout election at a time when we have never voted on something like this in modern times. In an election that usually only attracts those that care a lot about political parties, and also has an electorate that tends to be much older and also, frankly, much whiter than the citizenry and the electorate that we'll have in November. And so it just seems like that our process is not well designed here to deal with an issue that is so incredibly important to so many people.
Thank you. I appreciate that, because I do remember the headlines when the decision came down, and that was a lot of the conversation, was that it actually probably was stronger than Roe v. Wade. But I think at this point in time, we kind of forget that, but that is part of how we got here to this point. Sandra, did you want to add something?
Yes. The fact that with everything that Dr. Neal said, we not just looking at the language of the amendment, not just looking at it from a very political policy oriented space, but looking at it from the context of like the sentiment of the people, the sentiment of the legislators who lead Kansas, and just everything that's happening from a greater context. This is more than just the words that they put on paper. As a birth warrior, when I call myself a birth warrior, I'm very intentional about that language, meaning that I look at things that are happening in the birth world from a warrior strategic perspective, like war. And so I see when there's language, when there's policies, when there's legislations that's written that could potentially do a lot of harm, then other birth warriors like myself are looking at what is the greater impact, what is going to happen, what does this imply, what can this lead to, how can we organize and prepare ourselves for that battle? Because this battle for the amendment, yes, it may seem neutral, and yes, it may appear not to ban abortion. It does not ban abortion, but in actuality, when you think about the war and the greater strategy, this is what it's leading to, because we know who the Kansas legislation is. We know what's going on in our nation, and we have to take all of that into consideration, how this is a greater threat for the civil liberties of all people, not just women, but for trans people and for non-identifying people who don't identify as women, but who also are womb carriers. And so this is a greater threat, not only on whether you decide to have a family, create a family or not, but it's a greater threat on our health and our access to health. And if we value them both, i.e. if we value women specifically, then you would value the thought that someone will have to travel miles and miles further to go get help, like the basic healthcare needs that they have for contraceptives or health education, or just basic needs that they may have and they may go to an abortion clinic for. And what we've seen when laws restrictive laws are being passed, we see that these abortion clinics are being closed down, and these abortion clinics are providing more service than just abortion to care for women, to care for majors, to care for our trans community, to care for womb carriers. And so if you value them both, then you will want to make some type of legislation action that is going to further reproductive justice, is going to create access and not potentially hinder it down the road, and allow legislators who lean conservative, who lean right, to make decisions about our bodies. And so I think it's yes, the language is confusing, but when you look from a higher perspective, it's very clear what this is trying to do. And it's not legislation that I feel from my community and what my community believes and what we've talked about is not legislation for us that is going to protect us. It's legislation that's going to give us back and put us back in chains. If you look at the greater concept of it all.
Thank you. Can we talk then a little bit more about just kind of the economic implications of what may happen going forward? Does someone want to address that? Is that something that Mainstream Coalition talks about, or not sure who wants to take that?
Not something we normally wade into. I will say with other bans across the nation, though, we've seen larger corporations, conventions. I'm speaking right now of the anti-transgender bans that are happening, or legislation that's popping up everywhere. We've seen larger corporations and businesses not wanting to do business in those states. We're worried that may happen here in Kansas as well. In fact, Governor Kelly has spoken out several times about that. It doesn't make good, it's not a good fiscal decision to take away people's rights, especially at the ballot box, because then we have to worry about retention. We have to worry about recruitment. And we want more people to be in Kansas, working, living, playing for the betterment of our state.
Just one note on economics, that we should keep in mind that providing health care to anyone is an economic act. And especially in this country where medical professionals are in a market, in the capitalist market, and have to work in that market to get people to decide to go to them for care. And one of the difficult things about this issue is whether it will bleed over into getting people to not enter a medical profession, because they are worried about prosecution. Also, and it works on, that would be kind of a pro-choice position, but also that there are lots of people who have deeply held pro-life positions, and they might not want to be part of medical care that they find to be violating their personal values. And we're already seeing lots of interesting kinds of discussion about whether pharmacy workers and nurses and doctors should be asked to provide care that they find to be morally objectionable. And also, we should remember that while we can draw these lines between what is natural miscarriage and what is an abortion, or if we talk about things like the D&E ban, what is a procedure that violates language in legislation and some from not. I think it is difficult, that there's a lot of consequences on our medical care and on the work of medical professionals. And frankly, just to be personal about this, I have 2 children. They were not born here in Kansas. I had a different job in Minnesota teaching at the time, but they were born in a Catholic hospital and paid for with Catholic college health insurance where I worked. And I had great birth experiences with OBGYNs that worked at that Catholic hospital. And also because of the work of a doula that was like Sandy, that led to a wonderful birth experiences for my wonderful 2 children. But one thing I worry is that the certainty that was there before the U.S. Supreme Court recent decision in May might at least temporarily be gone. And one thing that our legislatures are not able to do right now is to provide certainty, because frankly, American politics has a very difficult time figuring out what it's about in 2022.
Thank you. I appreciate that. I wonder, Dr. Scrafford, did you want to address something, that just what are you hearing within the medical community? Are doctors fearing what might be coming through the laws?
Yeah, and I think on both sides, I certainly hear concerns from both sides. I think both of the points that Dr. Allen mentioned are true. There are both concerns about not being able to provide abortion or fear of litigation. Now, again, to point out that wouldn't follow from the amendment, but potentially from separate legislation. So that's worth clarifying. And then there's also a lot of fear on the other side. There are a lot of medical students who are passionate about women's healthcare, would really like to pursue a career in OBGYN, but increasingly in the culture of obstetrics and gynecology do feel intimidated from that field if they themselves are not going to be comfortable providing abortion, or especially if they feel even one step further that, for example, women's rights begin in the womb, and that a lot of what motivates them about protecting women's rights is that they want to protect the rights of a woman, not only during the time of her life after her birth, but also during the time of her life before birth. And for people who are strongly motivated for that type of view of medicine, there is a lot of intimidation about them being able to publicly speak their views, if that's a big driving factor. I am there right now. There's a coalition of about 250 medical providers throughout Kansas who have signed on behind the amendment, expressing, concern about the potential impacts that could follow from a totally unregulated industry. And as I mentioned, there's concerns on both sides. I think what I observe the most, or what I would want to see in our community, is an ability, both socially and within the medical community, to be able to draw up our own social constructs or social contracts, and to be able to practice medicine, including access to abortion, in a way that is consistent with our views as a social community, and in a way that's consistent with our views in the medical community. That's the value that I see in the amendment, is just the ability to maintain that conversation. To be honest, a lot of this conversation we're having tonight really has me encouraged. I like that we're talking about legislation, both good and bad. I like that we're having conversations about abortion because it's an important social issue. And I want that conversation to be able to continue in our social and medical communities.
Thank you very much. Lucy, I think we wanted to go ahead and take a couple more questions perhaps from the audience.
Yeah, thanks, Mary. It looks like a lot of people want to know about and I want to bring this back to, because we're supposed to talk about legal, economic, and human implications here. And so I think that an interesting thing for everyone to sort of give their perspective on as we wrap up here in these last 15 minutes is how women and how everybody in this situation is being valued, what types of value and moral judgments are being made in the medical profession, by individual legislators who are passing policies. What is this moral question that we're asking here, and what is our answer if we move in certain directions? So I think that's maybe the point, that a lot of different questions from both sides of the aisle on this issue are kind of coming to. How do we want to value these two parties there's more than two parties involved, arguably, but how do we want to value the parties involved here? And how are we messaging or signaling that we're valuing them if we choose a certain path?
Great, thank you. Who wants to go first on that? Going once, twice. I think some of that deals with, just the actual impact going forward. What are we seeing right now that's occurring? There is a lot of confusion, as we have said, as different states, when you take something that was legal across the United States, and now it's going to be a state-by-state battle within legislatures. Sandra, did you want to go ahead? You were first, or Michael?
Yeah, I first want to say that in this, that I feel as a Black birthing person and a representative of my birth working community and other Black birthing persons, I don't feel valued in this legislation. I don't feel valued at all. I feel like this is I can't even call it a slap in the face, because it's almost like a gut punch again. to the BIPOC birthing community to say that we don't care about you, and furthermore that we want ownership over your body and ownership over the decisions that we believe should be our decisions for our bodies. And so it takes us back hundreds of years. It takes us back from where we're striving to be. And as a Black birth worker, as a Black birthing person, we have heard the statistics about our birth outcomes. We know the history, the racist history in America and how it impacts Black America and other BIPOC Indigenous persons. And this impacts us. This is another fold of trauma for us, another way to show that you don't care, because as we continue to have the conversation of reproductive rights, again, for our community, we're talking about reproductive justice. It's great to have access to abortion, but if you can't pay to get to the facility to get the abortion care you need, even if it's in your own state, how can I consider to pay for somewhere out of state? As you talk about the economic impact of it all, but I bet those legislators who are making decisions or who are saying value them both, if their significant person in their family needed an abortion, they will fly them across the moon to go get it, and they will have the resources to do so. And that's just not the same for my community. And so my community does not have access when abortion was across the state, across the nation, legal and seen as a right. We were fighting just to get access. So to continue to repeal and to continue to threaten that access and minimize it even more just shows us that you don't care, and just shows us that we're not a part of this decision-making pool. To know how the politics of it all and how it's set up to be a special election in August where voter turnout is very low, especially voter turnout for my community was like very low. This shows me that this is a strategic approach to say you don't care about us, and to furthermore, not only just say you don't care, but to put us in a position that we've worked so hard to be away from, that our amendments like the 14th Amendment in its flawedness, but at least in some civil rights measures have strived to put us better than. And so, I don't feel valued in this legislation. And as I said, I think it's a greater threat to our civil rights. I think it's a greater threat to our human rights. And that's what I've been hearing from my community. That's what I feel as a birth worker. It's harder for me to support my birth community in something like this, we may need to have conversations about this. It's harder for me as a birthing person when I have to make a decision about getting essential needs as a birthing person. Where am I going to go? Is there access in my state? Will my state insurance provide for it? Like, there's so many levels to this that it just, at the end of the day, all of the confusion is very clear to me. And it says that you don't care, and that this is not about valuing me as a BIPOC birth worker and as a BIPOC birthing person.
Yeah. Thank you very much. I appreciate that. Michael, you had your hand up as well.
Yes, thanks, Marion. I just wanted to, talk to the maybe moral implications, or how we're valuing different people. And first, I'd like to lift up what Ms. Thornhill said earlier about taking a Gestalt view of this, because this is decidedly an issue of separation of church and state, no matter how polarizing this is, or about religion and government, however you like to frame that. It's a very polarizing issue. Right? It's a very difficult issue to talk about sometimes. And I think that we're missing the mark, generally speaking. People are missing the mark when they talk at each other and don't talk with each other. And that's no one here on this panel tonight. But it's a religion and government issue, and it's being driven by a narrow Christian worldview, predominantly a Catholic worldview, because we keep bringing up morality or morals or values. And not all religions believe that. And we are not a nation of one religion. We need to respect all religious beliefs. I'm a person of faith. I happen to be Christian, but I know that my neighbors aren't. And so we need to take that into consideration. Look at the other issues or initiatives or attacks, if you will, on other marginalized communities, not just women. They just happen to be the collateral damage in this issue. But you have anti-LGBTQ rights, diversity, equity, and inclusion. These are all driven by a very deep crack in that separation of religion and government. And I don't know the answer, but I do know that we're working very hard to bring people together if they are willing to come together again. But we all need to realize, step back, that we all come to this with a different lens and different beliefs. But that doesn't mean that we can't craft some policy that makes sense, some common sense policy for all Kansans that values every one of us.
Thank you. I think that's actually a good segue into kind of how we tend to wrap up these sort of sessions with American Public Square. And that's what they have. Each panelist has the opportunity to answer the question, so what, and now what? And just take that however you want. Just, how would you like to frame your closing remarks now that we've all heard from so many different perspectives this evening? And frankly, they've all been just wonderful. Everyone here has added so much to this conversation. Did someone want to go first? Or I'll be the teacher who calls upon someone. So what and now what? How would you reply to that? Okay, let's see. Who shall I pick on first? How about Elizabeth? Or did you? Oh, you want to? Okay, I'll take
I'll go ahead and start. As far as the so what, the so what is that we as Kansans have a very unique opportunity to weigh in directly on the public policy of our state in something that is very, very important to, frankly, anyone who thinks seriously about politics, morality, and ethics. And it's also an issue that will not be settled in terms of our discussion in any of our lifetimes, because this is not an issue where we will somehow come to a consensus that one side is always correct, and that all of us should understand that there are negative consequences for any of our own positions, whatever they happen to be. And also, as far as what next, I mean, it's time to vote. And also, hopefully, Kansans and Americans in general will see this as an opportunity to engage more, not less, in the political process. And so if value them both fails, then there will likely be further attempts by those that want to regulate abortion to either amend the state constitution, or also the 6 out of 7 Supreme Court justices are up for retention election in November. And that's a chance for Kansas voters to weigh in, particularly if they are opposed to abortion rights, because the justices that are up tend to be mostly supportive. And also, if the amendment passes, and we should note here that any outcome is possible. Polling makes it very clear, and every other indicator that this could be very close. That if it passes, then it matters a lot more who we elect to send to Topeka. And so the only way for us to have a real say in our lives, particularly now that the U.S. Supreme Court is no longer preventing legislatures from regulating in this area, is to come out and vote on August 2nd and vote in November, and vote as long as you still live in this wonderful state, and so that you can affect the rules that govern your life and the lives of your fellow human beings.
Thank you very much. Next person, who would like to answer the so what and now what query? How about Dr. Scrafford?
Sounds good. Yeah, thanks again for having me on. And I think for the so what, I'm just really struck by all the really good points that everybody's been bringing up, all the factors that go into, again, the social contracts that we as a community would make regarding abortion, and the different competing interests and values. Those are all things that I'm certainly sensitive to, not only as a citizen, but as a medical provider. For the now what, I agree, it's time to vote. And I think to stick with that same theme that Dr. Allen was mentioning, my hope is that we will continue to be able to have civil discourse on this topic because it's an important one. I think that being able to being able to continue to have conversations about legislation and regulation is important. And so I just hope that we end up in an atmosphere where we can continue to have public discourse on this. And I appreciate everybody having me on tonight.
Thank you very much. Sandra, do you want to go next?
Sure. For my so what, I think issues such as reproductive rights, as they're phrased, and abortion rights brings different identities together on an issue that can impact all of us. So the so what is that now that the issue impacts you and you can learn a lot more about reproductive justice, this puts you in a position where you can also take the now what and ally with the reproductive justice movement led by BIPOC persons, and should be centered on by BIPOC persons. A way that you can do that is one, coming to us for answers, coming to us to seek what the next steps are. The organization MoCan BIPOC Reproductive Justice Coalition and Real Justice Network will be actually hosting on July 28th a Facebook virtual conversation for allies and for advocates for reproductive justice to join. And you can come to that conversation as one of those now what's. But furthermore, I want to speak directly to my community. Our now what is to think about what our ancestors did. When our enslaved ancestors were legally possessions of so-called masters, what we did is took to our roots. What we did is called upon their ancestors to seek answers about what our future is going to look like. What we did is envision a future where our children will thrive. And that's what we have to do today. A part of that is making moves and making decisions to be with our community and to seek a vision where we do thrive. And so we've been fighting for many years, and the fight seems like it's going to be even further. But my now what for my BIPOC birth workers and my now what for my BIPOC community is to take some rest, to gain energy, and to continue the fight, but to also remember to thrive in all that we're doing, and to seek our ancestors for our greater support, and to rally with our community so that we can continue to fight for our sovereignty in the future.
Thank you very much. Michael.
Thank you, Mary, and I'd like to thank all the other panelists here tonight for this really civil and informative conversation, to the KC Media Collaborative, and to Denisha and Lucy for helping to host this event. So what? So we have a very important decision on or before August 2nd this year. What's at stake are human rights. And they should not, unfortunately, they're up for a public vote, but human rights should never be decided by a public vote. We have already heavily regulated abortion in Kansas. Abortion care has strict guidelines on safety. There are a number of other criteria and restrictions and that we've gone over this evening, so I won't recount those again. But Mainstream's always here to help you figure that out, so you can always give us a call. What now? Vote. Vote. I can't press that upon you all enough. All registered voters in Kansas can vote on or before August 2nd, whether or not you're affiliated with a party. So Republicans, Democrats, unaffiliated, independent. Get out there and vote. It's your right, your responsibility, it's our duty. And I would ask that everyone have leave here tonight with maybe a love your neighbor kind of perspective. You know, let's continue some civil discourse on this. We're not all going to agree all the time, but there's going to be aha moments or light bulb moments for people. So again, I really appreciate this opportunity. And if you haven't already voted, get out to the polls for advance voting or on August 2nd.
Thank you very much. And Elizabeth.
Yes, thank you. I want to also thank everyone for your participation. There's several arguments I would love to keep talking about. But tonight's discussion was organized on the basis that civic engagement and public discourse is a good thing, right? hearing from diverse voices is healthy. It's the way we achieve compromise without, hating one another. And I think the democratic deliberative process is the way that all of the arguments that we've touched on tonight, that the various panelists have made, that's the way these things get worked out best in our country. And that's all a vote for value them both is. It's a vote in the confidence. It's a vote of confidence in the people of Kansas to work abortion policy out together, to hear from the various voices about how abortion impacts their community, about the circumstances that drive women to think abortion is their only option. A yes vote just allows these conversations to continue happening and all of those interests to be heard. If value them both doesn't pass, Kansas, while it has these abortion restrictions now, as others have pointed out repeatedly, they will all be struck down under this strict standard. And Kansas will likely have one of the most pro-abortion legal structures in the country. But the point I want to make is not that. It's that structure will have been forced on the state with no access to the democratic process to resolve our disputes. Voters in California, voters in Illinois, voters in New York, they've voluntarily enacted into law through the legislative process very protective of abortion regimes. And if we want to do that, we can do that under them, value them both. But I think such a complex issue like this needs to be resolved by the people. And that's all that value them both does. So the now what would be vote yes, and then work to embody in Kansas law the abortion policy that you think best fits our state. Thank you.
Thank you very much. And we have run on quite long, but I think that's because, as Elizabeth just said, there's so much more that we could discuss. And what I would encourage is that everyone go out and discuss this more, and particularly with someone who does not believe the way that you believe, and ask them why. Ask them, what were your experiences? How did you come to the place that you are now? I've always found that that's like one of the best ways to interview people. And I think it's one of the best ways to live within our society. So I would like to thank American Public Square, the Kansas City Media Collective, Lucy Brock, who's done such a wonderful job, Denisha Snell, and certainly all of our panelists this evening. For any of the viewers, you can come back and listen to this online at another point, but be sure and keep tuning